मैं डॉक्टर गुरसतिंदर सिंह आदेश मेडिकल कॉलेज में मेडिकल सुपरिटेंडेंट के पद पर काम कर रहा हूँ और यहाँ पे आंखों के विभाग में प्रोफेसर का काम भी कर रहा हूँ। आज हम बात करेंगे ग्लोकोमा के बारे में, उसकी बेसिक बातें, उसके क्या लक्षण है, उसका क्या इलाज है और उससे क्या नुकसान हो सकता है। Glaucoma is a disease in which there is an increase in the pressure in the eye. So this increased pressure within the eye leads to the pressure on the optic nerve, which is this nerve connects the eye to the brain. So when there is an increase in pressure in the eye, this damages the eye. Initially peripheral vision is lost, but later on central vision also goes. Glaucoma is fairly common. Like we can see that by the time of 2040, we are going to have something like 110 million cases the world over. And in India, in the various surveys, the incidence rate varies from 1.4% to 1.8% in various studies. Glaucoma is essentially a disease without symptoms. That is why in colloquial language we call it Kala Motia. There are no symptoms in this disease. The only thing is some intelligent patient may say, I can't track a golf ball, or he has difficulty in picking up the objects from the higher shelves, or he may bump into the objects lying on the floor. So these are the initial symptoms. Otherwise, it's a symptomless disease. There is another type of glaucoma which is called angle chloride glaucoma, in which the patient may complain of colored halos around the light in the evenings, and at times he comes with the acute attack of glaucoma, in which you have pain, redness, lacrimation, headache, and diminution of vision in the eye. In these cases, the treatment has to be very prompt and immediate treatment is required. Age of 40 should get himself or herself screened for the glaucoma. But the people who have a history of glaucoma in their family and their parents, brothers, sisters, or patients who have got high myopia, or the patients which have diabetes, they are more at risk of glaucoma. Glaucoma initially doesn't lead to blindness. The sad part is that patient has good central vision. That means he can read very clearly, but it's the peripheral vision which goes down initially. So the defect starts in the field of vision. There is a general constriction of the field of vision over a period of time. At end of the day, patient may lose the central vision and he may become even blind without treatment. The glaucoma is generally now we are lucky in that we have so many drugs which are available to us for treatment of glaucoma, and we have drugs which are very effective, and they were discovered. Most of these were discovered in the late part of the last century, and the drugs are the mainstay of treatment nowadays. So we can give one drug, two drug, or combine different drugs to bring down the pressure in the eye. Otherwise, if it doesn't work, then we can do the surgery in these cases, and also the lasers can be used for treatment of glaucoma. The glaucoma is not a preventable disease. You can just prevent the progression of glaucoma, or in angle chloride cases, if you do the YAG iridotomy, you can prevent the progression of glaucoma or disease from progression or for disease from happening. The glaucoma patients, the first checkup is as I told you, it is a disease which occurs beyond 40 years of age. So whenever you go for a refraction or go to an ophthalmologist, get your pressure checked up at the age of 40 and beyond. So once you get the eye pressure checked up, if there is any indication of glaucoma, the doctor will test your optic nerve and visual fields are done, and then of course you can go for OCT and other tests. So ideally it's a disease which needs to be screened as it doesn't have any symptoms. So we call it opportunistic screening, which is the best method. That is, whenever you go to a doctor for a checkup, get your pressure checked and get your optic nerve checked. The glaucoma one can be congenital or developmental glaucoma, which occur in the children, and there are very few cases. But most of glaucoma they occur up to 40 years of age, and the glaucomas are primary glaucomas or secondary. The secondary glaucomas can be secondary to any disease like any inflammation in the eye, or steroids are the one drugs which can lead to glaucoma. Long-term use of steroid can lead to glaucoma. So you have primary glaucomas or secondary glaucomas. As I indicated earlier also, in all cases we do the intraocular pressure by different methods. We do the optic nerve examination, and sometimes we do take the optic nerve photographs for our records. And then other tests are visual fields and OCT, ocular coherence tomography, which tells you about the health of the retinal nerve fibers.